government has now drawn out a containment plan as clusters posing high risk of further spread of coronavirus diseases have emerged in several states. The cluster containment strategy is meant to contain the disease within a defined geographical area by early detection of cases, breaking the chain of transmission and thus preventing its spread to new areas. This was declared in a 20-page document that says that the aggressive containment strategy will be scaled down only if there are no new cases of COVID-19 reported for at least 4 weeks after the last confirmed test. Let's go across to Arvind, who's been monitoring this. Arvind, I want to ask you focus more not so much on the details of this new strategy, but was there a debate over which strategy option should be followed, given the fact that India wasn't and isn't testing as much? Should the containment strategy that the government seems now to be adopting, many had said should have been adopted much earlier?
Yeah, Sarah, as the number of COVID cases have crossed around 3,000 today, the Health Ministry has come up with a containment plan to contain the outbreak of COVID-19 cases across the country. In fact, as per this particular document by the Union Health Ministry, what they are saying is that as on April 2nd, 211 districts have reported about the spread of COVID-19 virus, while in today's press conference, the Health Ministry has said that in the last 2 days itself, that is as on April 2nd, around 211 districts have reported about the spread of COVID-19 virus. But today, in the span of 2 days, this particular spread has increased to 60 more districts. As on date, 274 districts have reported about the spread of COVID-19 virus. So this particular spread, this alarming rate has actually made the doctors and also other officials who are actually part of the National Task Force a bit worried, and that's why they have come up with the containment plan. Like you said, this particular containment plan should have been come much earlier. That's what most of the experts are also pointing at, but at least this time the government has come up with this particular containment plan. This particular containment plan has been sent to all health departments across the country. What the main prime focus of this particular document, this particular plan, is to break the chain of transmission. This is what the government is actually focusing on this particular point of time. When we spoke to a senior official who is actually part of the National Task Force, what he is saying is that the moment India enters the stage 3, that is the community transmission, then there is no stopping. So government is taking every step to prevent India from entering stage 3, that is a community transmission. So even this particular plan also primarily focus on that particular point, how to contain the spread in a local area. So this particular document looks into geographical area, local level and also district level. Apart from spread, this particular plan also deals with management of COVID cases. In fact, there are 3-tier strategy that has been put forth by the Health Ministry, where they are saying that if the patient has been tested positive, then that particular patient has to be taken to the hospital. Mild cases has to be taken to the makeshift hospitals. Mild to severe cases have to be taken to the COVID-19 exclusive hospitals, and severe cases have to be taken to the critical care unit. But one good point is that only 15% of the total COVID patients need hospitalization. So that is one good point that the doctors have arrived at, though government is taking all precautions, all necessary steps to confine this particular to confine the spread.